And for programs just starting out, what advice would you give on where to begin and how to make it sustainable?
Yeah, that's a great question, a really important question. 2 years ago, we established a task force within NATSAP, and one of the questions we were trying to answer is this: how do programs get started? I mean, out in behavioral healthcare field, my experience has been is when I have conversations with my colleagues, program owners, executive directors, they're very interested in investing in research and outcomes and understanding what they do. But they're oftentimes there's not a researcher on their team. There's not somebody who can sort of drive that. And so it's hard to know where to get started, what tools to use, how to implement it. So, if you're not the norm and you don't have somebody dedicated to your team who can tackle this, which is fantastic, then I would encourage programs to look out and get some outside support, even if it's just to help get you started. And then at the end, often it makes sense to bring those folks back in so you can tell the story of the data, right? Here's what we're going to collect. Now we go about collecting it, and then we're going to bring that back and we're going to tell a story, right? I think that programs should invest in what do you do? If we specialize in treating anxiety or eating disorders, for example, then that's what we want to measure, right? Because that's what parents are going to call and potential clients are going to call and say, hey, this is what I'm coming. Can you demonstrate that you actually deliver results on what you say you do?
Absolutely. One thing that I would add is we like to embed research at every level of the organization. And I think if you're going to embark on basically measuring outcomes, you would want to have it involved at every level because it really is a wraparound approach. It's not something that's just an add-on. I think that collecting data from clients can be very challenging because it takes time and it takes consistency. So having it just involved and part of the tapestry of who you are as an organization helps to increase the, buy-in across everyone, not just clients, but even staff. It's an all hands on deck approach. And something that we do is build basically goals and accountabilities around our data, the results of our data that we get every quarter or every month, depending on the cadence of that data. And it really helps to ground each department in what we're doing well and what we could be changing. And then setting goals that are, realistic and also going to make the difference that we need to make so we can offer the best quality of care. And one thing, as of the past couple of years, we are measuring all key stakeholders, so clients, their families, referring professionals, and our own staff, because we really believe there's a parallel process happening, and each level of, that parallel process, they're intersecting at times and at different points in treatment. So it's important to make sure we understand the impact of each of those levels and how they're relating to whether it's outcomes in clients or satisfaction in our staff, and making sure we're adapting our approach to fit everyone so that we can, again, it's always about offering the best quality of care and making sure that what we're doing is working as best it possibly can.
Yeah, if I was a parent, I was calling the dorm, and you were able to say, "Hey, here's what we're looking at," and you're looking at all of those different things, and you're able to provide some information. Just the fact that you're investing in that alone, just not even knowing the results of the outcome, that's going to build some trust and faith.